what we are asking for and pushing leadership for is improved staffing numbers. We have been and continue to be in a major staffing crisis. To put it in perspective, I worked this last weekend and most shifts in our unit were 9 to 10 nurses short. That puts more work on the nurses that are working, less visibility to parents and patients, and it's just not safe. Most recently, we have exploded with respiratory patients, children who are sick, really, really sick. Most belong in the ICU. We don't have enough ICU beds, so they're on the med-surg floors. You could have a sick patient who's part of a 4 or 5 patient assignment because the unit is so short-staffed. 6 to 8 hour waits in our emergency department. Kids scattered around the waiting room, the cafeteria, conference rooms, far away from the emergency room. Besides the ED waiting hours, the ED is full of inpatients who have nowhere to go, sometimes because we have no staff to staff the bed that they could possibly go to. The ED is a disaster zone. They are working sometimes with only 4 to 5 nurses, and they have a waiting room of 75 kids and a unit of 32 rooms that have 2 weeks ago, 27 inpatients, leaving just a few rooms for them to shuffle the dozens and dozens of patients that are sitting in the waiting room. Our hospital has lots of buzzwords, all hands on deck. That was their famous buzzword in the past. They did a newscast where the upper leadership was shown in the ED doing tasks in front of a camera. Well, the cameras are gone, and so is leadership. We've been begging for help for 2 years. It's fallen on deaf ears. Our leadership tells us daily, we hear you, we value you. They have a funny way of showing it. They spew empty promises and say they value us, yet when asking for help with staffing, they do very little or nothing. On September 23rd, I emailed my nurse leader, our chief nursing officer, asking her to join with her nurses to help work on these issues. Today is November 30th, and I have yet to get a response. Our hospital is on life support. We need change. We need improved staffing. We need our leaders who claim to value us to prove it. Our patients and families deserve it, and we, the nurses, deserve it.